I want to get into where the donations are able to go. So let's jump back over to the website for a second here. There are 4 primary places at the moment where you can allocate your funds. I'm going to click on donate, and as you'll see here, you can again search for a spinner, or we can select some spinners who will get a nice surprise donation from you right there. Let's go over to the cause, because this goes through where you can allocate your donation. All of the donations go to the Canadian Cancer Society. This is a new-ish fund right here, the COVID-19 Cancer Emergency Fund. Obviously, this was brought in during the time of COVID. We did this as a response in conjunction with the Canadian Cancer Society to allocate funds directly to research and care that has been necessary during the COVID-19 pandemic. So this goes to 2 primary areas when you donate here. One is an immunization clinical trial in which researchers are doing drug tests and research on IMM 101. That is the particular drug being researched. And it is all about respiratory infections, particularly in cancer patients, and has overlap with COVID-19 symptoms and cancer treatments. So super, super valuable right here. This is when you donate here, those funds go to the COVID-19 immunization clinical trials within a week and start working. That has real world effects on what this pandemic could become. The research that is going on in these trials is helping to inform other research in clinical trials to do with both cancer care and with COVID-19. As well, we know very intimately that the pandemic has been a massive trial for mental health. So the Canadian Cancer Society has various ways of supporting cancer patients, caregivers, volunteers, anybody within the cancer journey sphere who needs a helping hand or an ear to listen to them or some advice. And so the other aspect that the COVID-19 Cancer Emergency Fund helps with and helps to fund is various types of cancer support systems, mental health support systems, and in particular, the Cancer Information Helpline and Cancer Cares. These are ways that the CCS lends support to different people all across the country. So if you need support at any time, these are available to you. All you have to do is go to the Canadian Cancer Society's website, which is cancer.ca. You'll get your regional aspect, and then you can click through to get any help that you need here. So I have cancer. This will help you get to the resources that you need. Even if you don't have cancer, this is a great place to find the resources that you need. Cancerconnection.ca as well, which you'll find the link in there. So here we go. And here you can start chatting right away with other people within this community who can help you out. Okay, let's jump on back to the donations. Let me find the correct one. Always fun. Here we go. The next is regional cancer research funds. These are granting programs in the different sectors that the CCS supports across the country. So British Columbia and the Yukon, Prairies, which comprises Alberta, Saskatchewan, Manitoba, and the Northwest Territories, Ontario, Quebec, and Atlantic Canada, which of course, New Brunswick, Nova Scotia, PEI, Newfoundland, and Labrador. And none of it comes into the Quebec aspect there. When you donate to a regional cancer research fund, it puts money directly into a granting program, which goes annually to research being done in your provinces or in your region. That is at-home research right there. That is incredible. It is the one where most people tend to put their donations. The third option is the Clinical Cancer Trials Group, which is yeah, which is cancer therapy. It is a national program that has component parts all across the country, but is managed through HQ in Toronto. But it is incredible for prevention, for care, for therapies of all types. That is amazing. Like immunotherapy comes through there, a whole bunch of different things that each of you has likely come into contact with your own cancer journey. Now, this one, our fourth one, was Wheels of Hope, but is now both Wheels of Hope and the Travel Treatment Fund. Wheels of Hope is a volunteer run program which is patient transport to and from care or wherever they might need to go. Wheels of Hope was basically you would phone up the CCS, the Canadian Cancer Society, and say, hey, I need to get to treatment. And they would match you with a volunteer who would come to your house, pick you up, and drive you to your treatment and then back again. Fully volunteers. They are amazing. But in the time of COVID, that program has had to be paused. We can't have immunocompromised people coming in and out of different vehicles, which is definitely sad, but it will pick up again once COVID is better understood and under more control. The Travel Treatment Fund, however, is still in full swing, and that is just incredible. So let's say that you do live in Nunavut and your treatment is in Quebec City, and you don't have an easy and viable way to get down for treatment. The Travel Treatment Fund is what the Canadian Cancer Society has provided to help get somebody to your house in Nunavut, pick you up, get you on a plane or whatever other transport, and get you to the treatment that you need in Quebec City. Same thing goes even if you are closer in. Like, let's say that you live in Swift Current, Saskatchewan, and you need to get to Regina, but you don't have a viable way. Travel Treatment Fund is what will help you out. So these are four incredible places, incredible different things that the Canadian Cancer Society supports that you can allocate your donation to when you donate, or when any of your friends, your family, your coworkers, whomever else donate through your profile at Spin for Life. We have a fifth one that will be coming in very shortly that is part of what Quebec and a bunch of people that we are adopting over from Grand Spin Dans, or a Great Spin in Quebec, have been supporting for the last 7 years, which is pediatric cancer care in Quebec. We're going to be adding that as a donation designation because of the incredible work that they've been doing in Quebec, and we want to honor that here. So you'll see that update in the coming days.